But my first question is keto or low carb diet heart healthy?
Yeah, it's a great question. It's a great question. Well, the answer is yes, but the more important question is, what is a heart healthy diet? And I think that's where we really sort of have a misunderstanding of what that means. Because if your focus is completely on, does your diet, do your foods lower your LDL cholesterol? If that is the only definition of a heart healthy diet, then I guess for the most part, a keto diet is not heart healthy. But I would argue that that is a complete misrepresentation of what a heart healthy diet is. And a heart healthy diet is one that lowers your overall cardiovascular risk factors. Well, those cardiovascular risk factors are type 2 diabetes, metabolic syndrome, hyperinsulinemia, visceral obesity, high blood pressure, low HDL, high triglycerides, size and density of your LDL particles, inflammatory response. All of those components are what make up cardiovascular risk. So a heart healthy diet would be one that can beneficially change the majority of those factors. And that's exactly what low carb and keto diets do. They are probably the best diet for improving blood sugar control, helping with visceral adiposity and abdominal fat, helping improve HDL and triglycerides, helping improve the size and density of your LDL cholesterol. I mean, they are a very powerful intervention for that metabolic benefits and those cardiovascular benefits. And there are studies, I mean, there are great studies to prove this. When you compare low carb diet versus low fat diet, all of those parameters change more on a low carb, generally higher protein diet than on a low fat diet. And when you calculate someone's 10-year cardiovascular risk, which is just this formula that your doctor kind of puts all your information is, and your risk goes down for the majority of people starting a low carb or keto diet. So based on those factors, I say yes, that a low carb keto diet can be and is a heart healthy diet. Subscribe to bnsgokugreat.